I'm Matt Loper, CEO of Wellth. We get patients to do what they're supposed to with behavioral economics. So I'm going to tell you two stories tonight. The first one is my story. This is my grandpa. Him and all three of his brothers had type 2 diabetes. My aunt and uncle also both had type 2 diabetes their whole adult life. My aunt has been completely compliant and diligent since she was diagnosed. Over the last 20 years, she's had 0 complications with her disease state. My uncle, on the other hand, had a much tougher time controlling his disease. He never, no matter what we tried, took his medications, listened to his doctor, tracked his metrics, or tracked his meals. And this resulted in him ending up in dialysis. He got a kidney transplant. Unfortunately, over the past 6 months, he's been in skilled nursing 24/7 and passed away after a stroke this year. So when I started this company, I thought about how can we help patients like my Uncle Roy perform the behaviors they're supposed to every day. Because if you think about Auntie Amy and Uncle Roy, they have the same background, the same diagnosis, the same genetics, but massively different outcomes based on the behaviors they perform. So when you think about our healthcare system, the behaviors are such an important problem. We do a great job of providing care within the hospital setting, but once the patients go home, we provide no support for them at home. And patients just simply don't do what is rational. We're all human. We have cognitive biases that prevent us from making the rational choice, like taking our medications every day. So why wasn't Uncle Roy taking his medications when he knew they were good for him? Because it helps him down the road. When he takes his metformin right now, he feels no different right now. This is a concept called present bias that we really focus on. You're going to see a bunch of really cool companies this week with a lot of really great products that are very helpful to their patients. But you can have the best drugs in the world, the best devices in the world, the best wearables in the world, the best apps in the world. If patients don't use those or take advantage of those resources, they do nothing. So what we focus on is actually getting patients to use those best-in-class devices, tools, and drugs. And we're able to do that by giving them tangible, immediate gratification, training those into habits that actually stick. It's way too late in the day for studies and data, but we'll just quickly go over a few. If you train a behavior over the course of 90 days, you get drastically better medication adherence over the long term. Same exact concept in remote monitoring. If you give away connected devices, if you train the habit every day for 90 days with an incentive, that becomes a very sticky habit even after the incentive goes away. We've been able to do this in big patient populations. I don't know what happened there. And scale this up. We're really proud of, even when selecting for the highest risk chronic conditions in Medicaid, Medicare, non-adherers to start with, every single use case, we're doing phenomenally well with 88% average adherence. So I promised you another story before the buzzer here. We weren't able to help my Uncle Roy in time. What we're really proud of is actually the individuals that we're helping. Data is just a collection of a ton of anecdotes. Here's one anecdote last week. A patient in Mount Sinai who had never become adherent no matter what was tried. More doctors, more nurses, more devices, none of it worked. In the past 2 weeks, we've gotten to be 100% adherent. Thank you very much.